patients, they knew exactly how Dr. Reich would do it and how to do treatment. Right? And he said, that's it. I don't want a lot of little Reichs running around. You know, I want you to learn the basic principles and learn how to be a therapist in your own, and use these principles in your own treatment. And in fact, we know when we, and that would actually be a wonderful conference. At some point, I'll finish on that remark. Okay? A wonderful conference would be to bring together as many of the actually practicing orgonomists, you know, people who are trained in this technique, to talk about how they actually work. And I think what you would discover, and I certainly discovered from speaking to many of the traditionally trained orgonomists who actually either worked with Reich or were trained pretty close to that line, that they work with a great deal of commonality in terms of the basic principles, but each one very different. The final thing was that when all of the doctors who would work with Reich finally were free enough to talk about their treatment with Reich, not one of them had the same kind of treatment. And they were all sort of amazed, you know, and so.
Thanks a lot. Let me remind you, the whole day is about organotherapy, so you may have lots of questions, but I would encourage that the questions now be more about the historical development that Dr. Lewis was talking about.
Right.
And keep your questions brief, and please keep your answers brief so we can get as many going, and then we'll take
You're implying that I might be...
so raise your hand so I can get a lot of voices in here. Questions about the historical development. Yes, please. I'll come to you in a second. Yeah. Go ahead.
You mentioned the material demonstration of orgone energy in the laboratory. Can you talk a little bit about what that involved?
Well, I mean, I think a number of other people here probably can talk about it even much more extensively than I could. I mean, essentially, once Reich set up his laboratory, eventually he began to investigate the initial investigations that led to the biophysical investigation of bioelectrical energy and sexuality were done largely in laboratory, looking at people's readings of people's excitation levels and pulse and various physical signs based on stimulation of the body. The literal isolation of orgone energy is a long and detailed process that's going to be far beyond anything I could lay out, but it's available in a number of books, mostly in the the Bion experiments, which will give you a detailed description of all of the literal work, and in the archives there's even more detailed clinical avail. Essentially, the laboratory through a series of both fortuitous accidents and discoveries. Don't think he's looking at bioelectric function. He begins to discover that, wait a second, I'm expecting X to happen, but Y happens. So the question is, why does Y happen? And as he begins to investigate these various deviations, in the expected behavior of bioelectric energy, right, or biochemical energy, he begins to realize that he's dealing with an energy that doesn't seem to, or phenomena, he doesn't call it energy initially, a phenomena that doesn't seem to be consistent with what they're expecting to find as the physical basis of libido. He then begins to experiment with techniques to see if there's any way of materializing that energy and seeing what it is and what it looks like. This leads eventually to the isolation and description of some sort of energetic function that is not bioelectric, what has relations to bioelectrical phenomena, but is not ultimately bioelectrical. Gradually, through various research and studies, he isolates that energy. The most striking demonstration of it is somewhat later, in the vacuum tube, irradiation, in which you take a vacuum tube that essentially should not, glow or generate any visible luminescence. Leave it in a intensely orgone charged room, and over a period of time, and there are photographs of it, it begins to glow blue. And so these are among the physical demonstrations, but there are numerous other microscopic examinations of the function of that energy and demonstrations of it, and experiments that demonstrate, that you can't explain what's going on without, at least hypothesizing a specific and quantifiable energy. And he begins to work on ways to quantify it, and in doing that leads to the idea of how do you collect it, which leads to the development of accumulators.
Trevor, please.
Yeah,
Is that enough?
I could be wrong, but I thought that genitality, the first function of the orgasm, is called genitality in the therapy of neurosis, came out in 27.
It did.
Yeah.
And so, because I feel like you missed like the crucial sex economy stage before the vegeto therapy. Like, so therapy, genitality, the book came out, Freud was championing the function of the orgasm, created sex economy, and then went to vegeto therapy.
I think you get too rigid in your. If you understand Reich and read Reich carefully, particularly in his personal comment, it's not a kind of rigid. There's sex economy and then there's vegetotherapy.
Sex economy was never
right.
a form of therapy.
That's right. A part of what part of it is I'm limited to how much I can address anything. Part of the understanding you have to understand about Reich is Reich never operated in one area. So what Reich is working in the laboratory, he's also working in the clinics, in the sex pole clinics. He's also working in active youth clinics. He's also developing concepts of sex economy, as a political and social movement. He's also writing his critique of, which Dr. Menick can address in even greater detail. He's also writing his critique, his unification of Marx and Freud, which leads to really a new, theoretical structure, which basically is the basis of sex, of sex economy.
But the way you presented the history, you had him developing character analysis and then later looking at the function of the orgasm. Historically, it's the other way around. Function of the orgasm, he published in 1927.
Right.
He didn't publish character analysis
Right.
until 33. Bob, you had a
No,
question?
but let me make something clear, okay? And we will argue about this. The fact that he's beginning to write function of the orgasm and talk about the function of the orgasm before character analysis historically doesn't change the fact that the central we're talking about therapeutic approach. The central therapeutic approach that Reich is working with pretty much until 1930, we could argue 29 or 30, is essentially character analytic in nature.
Oh yeah, he's
And the significance of and the interest in the function of the orgasm is simply, becoming background to what he's beginning to structure and think about as what the goal of character analytic work is, okay? The specific movement into vegetotherapy becomes significant is at that point he decides that you're not going to get there with within a more traditional psychoanalytic process of interpretation, and that there needs to be a much more energetic engagement and energetic interface that leads to the development of techniques that then become known as vegetotherapy. The other thing to keep in mind, which is also interesting because it was true of Freud, is that Reich, we're in this process, and you're actively in this process of dating specifically where and when things come along, and that's very good to do that, right? But Reich never worked that way, and so when you really look at the papers and you really look at the way Reich was often, writing about things well ahead of the time he ever published. He was often thinking about movements he was going to make, things he was going to explore. He was introducing ideas and experimenting with ideas that get published later. The dates on when he published things and when he introduced things and when he dates things himself are often very, very equivocal and problematic. Freud, for instance, was always well known for publishing things that he had developed 10 years before he actually finally published the paper.
The early chapters of character analysis of the paper is published in the mid-20s.
Right, that's right.
Impossible.
Yeah, here.
Bob, go ahead.
I think